Hi, everybody. Good evening. It is November 17th, 2014. Tonight's webinar is one entitled The Identified Patient. And really, what I wanted to talk about, it was a way to talk about the function of the system, or excuse me, the function of the symptom in a system. And it's really talking about the role that the identified patient plays in our treatment. It's the history of the idea of the identified patient and the development of systems work or systems theory. It's this idea of circular causality, where we look at changing a system in order to change the individual in the system. And our idea is that oftentimes the symptoms make sense in that context of the family system, and it takes away the blame and the shame and the direct causality of the whole process. So it's about talking about our children's symptoms and diagnoses in the context of the family system. So that's really what tonight's webinar is about. So with that, let's get started and talk about defining the identified patient and this model that has existed for some years. It, Historically, the treatment in psychology started off with individuals. It was rare that they would meet in groups, but never in the early days of treatment did they meet with more than one person in a room in a family system, or at least it was not a model that was taught or talked about or that was published to other people. It might happen on occasion, but it really wasn't the idea. And they saw pathology and health fully contained within an individual, right? Back from when Freud essentially started the idea of psychotherapy to well into the 60s and 70s. In the 60s and 70s, they started to look at and treat the families for the first time and started developing several models and branches of the family therapy or the family systems approach. And initially, we talked about this idea that imagine a family getting in a car wreck or a car accident, and although there was someone driving the vehicle, there was injury sustained by everybody. And so part of that suggests that this primary role of the symptoms, it's not that family members cause the system, but this is an individual's response to the system. And oftentimes, as it is an example in the car accident analogy, that ends up affecting everybody in some pretty profound ways. Family systems therapists, like I said, in the 60s and 70s, came in and said, we're going to look at the relationship between individuals in the system, and we see this idea that when one person changes, that there's forces in the family that ask that person to go back to the status quo, and that sometimes when we change one part of a system, we see its positive effects on other family members. So they started to understand this idea of treating the entire system at once, and really a combination of working with individual symptomology and with family systems was and is ideal today in treating difficulties in diagnoses and pathologies. There's this idea that the IP, the identified patient, essentially is the lightning rod or the focus, initially at least, of treating individuals or treating a family or treating symptoms, while they get all of the attention, oftentimes, especially early on in treatment, that there are tentacles and processes and relationships with everybody in the system that have some relationship to that issue or to that symptom. They're the most symptomatic. They don't get simply elected to the position of identified patient. They sign up for it. They participate in it. They earn that role, that label. So it's not a kind of victim to the system, non-participating role in the family. It actually is something that they sign up for consciously, or they're simply, most of the time, of course, unconsciously. But it serves a function. It serves a function to focus anxieties, to focus energy and anger. Oftentimes, we see in a system where a child becomes symptomatic that there are processes between other family members or parents in many times or co-parents in many times that system, excuse me, that symptom of the identified patient child seems to alleviate some of the tension. That's why a lot of people will talk about when the identified patient goes into treatment. Some of you might be able to speak to this, but when the identified patient goes into treatment, that we see other anxieties, anger, problems in other relationships. Sometimes another child in the family begins to act out. And that would be evidence of this idea, this model of the identified patient. So it serves some kind of function. And that's a really important piece. Really, in all treatment and all observations, is that everything, every symptom that we all have, great or small, makes sense in some context. right? It serves to alleviate some kind of pain or discomfort. So when the question is asked, generally, why does my child do this? Our answer always is because it works for something. We don't know what it works for just yet, but we're going to, with the child's help, get to the bottom, get to the root of how it serves them, and then give them other tools. And a lot of those tools are really about learning to feel and tolerate the feelings that they're trying to escape, or learning to change the way that family members or systemic members participate in relationships. A lot of times they become the scapegoat. It becomes so much of a focus that even as parents, we lose the ability or the want to focus on ourselves. That's why so much of my work is asking family members to focus on your side of the street, to take care of yourself, to focus on what you can improve. And this is the amazing thing, because it's not a trick or a smokescreen. When we, as family members, participate in our own recovery, in our own work, not initially, but eventually, that has very positive contributions to other people in the system. Oftentimes, those initial shifts by any one member of the family are resisted or rejected by the family members. Like I said before, there's a homeostatic, that's a systems theory word, there's a homeostasis or a homeostatic energy that asks the person who has made the positive change to change back. I was just doing a family session not too long ago where a young adult daughter was saying to her father, I'm going to make some changes, and some of it's probably going to trigger some anxiety in you, and that's something that you're going to have to work on. That will become your problem, and I'm going to make it not my problem anymore. And it was a very healthy, very assertive thing. And she was anxiously approaching her father, very powerful, very put together man, saying, I'm going to announce right now that your anxiety, your worries are not my problem. They're yours to work on. What are the tools? What are the skills? What kind of therapy? What kind of meditation? What kind of daily reading or support group can you go to manage your anxiety so that I'm not asked to carry it? So they become the scapegoat, but oftentimes they are really just evidence of something in the family that needs attention in this process. Triangles is an idea from one of the schools, one of the early schools of family therapy, which says that dyadic relationships between two people are unstable, and the most stable relationship is a triangle. And that means that I'll use myself as an example. If my wife and I are having conflict, instead of dealing on and working through that, we're likely to pull somebody in to our relationship to express that anxiety. It could be a child, it could be another family member or friend, could be to start off with a therapist. And ideally, when the therapist enters that dyadic, that couple relationship, he or she seeks to push back on each of the individuals so they begin to work on each other in the process. There's a famous old story about Murray Bowen, one of the fathers of family therapy, where he tried to really work on and detriangulate the relationships in his family. And one of the ones that he identified was they were coming up to a family reunion, and he wrote everybody in the family, cousins, siblings, parents, everybody in the family, these are the rumors about you. This is what people are saying about you. And of course, that was a provocative and dramatic way to do it. But basically, what he says, I'm not going to hold on to anxieties, to other people's anxieties. I'm going to put them back into their dyadic relationship so that they can work on it. Another example is he would get a call from his older mother and father at times complaining or saying something about the other parent. They were married still. And one time after receiving a phone call from his mother, he hung up with her and then called his father right away and said, your wife is having problems with her. You should probably talk to her about it because she's calling me about it, and listed off some of the problems. So it's saying, I'm not going to take that on. I'm not going to be the middleman in this relationship and the conflict and the difficulty that you're having, that everybody has. But think about that yourselves. How much easier is it for you to vent or complain or express anger, frustration, anxiety with somebody about somebody else? And we find ourselves often creating a foundation in some of our relationships where it's based on complaining about a third or fourth person. But the hardest thing to do, and this goes with every relationship, the hardest thing to do is for me, if I have some upsetness at you, to go straight to you. That is why in therapy, one of the most important processes, one of the things I value most in the therapeutic Relationship is when a client can come to me and complain about me, express sadness, frustration, anger, disappointment, hurt at me about me. That to me is the best kind of practice, the best kind of development that an individual client can do when I'm working with them. So I want to talk about the identified patient more specifically in some different ways. A lot of times what our children's behavior, what our children's personalities, what our children's problems invite us to do is to stretch ourselves. They scare us. It doesn't mean we become tolerant and have no boundaries in our lives of everything that's going on, but we ask ourselves difficult questions. And I'm not even talking about some of the more severe symptoms. I'm talking about the way they present themselves. I have 4 children, and each of them asks me to stretch myself in a different way, to go beyond the limits of what I thought was, what my contacts told me was. That's why when our children express something that or demonstrate something that we weren't allowed to express as children, it causes us a great amount of anxiety. So our children stretch us, and our children with the symptoms that your children have ask us to stretch even more, right? They don't do this consciously, but it is part of the process, part of the journey that you have been invited on, is to work on this in the context of working with a child. Again, boundaries, consequences, limits are all to be in place in this model. But our reactivity and our dramatic fears and anxieties and frustrations and anger and judgment, all of that stuff, our child is inviting us in an unconscious way to stretch ourselves, to learn about ourselves, to look back into our history and to understand what was it that my family of origin said to me, taught me, what were the messages from my family of origin. This idea of codependency or really co-participation. Especially therapists, by the way, we are incredibly prone to this. We're in a profession, in a career where it becomes our job to work on other people. That's not a coincidence, right? That you can imagine that would attract people with a lot of significant codependent issues, where our worth and our value, our sense of our own success, becomes very tied to whether or not our clients change. We've been taught as children, a lot of us, or we've been asked to pay attention with a very sharp sense about what other people are thinking and feeling. And who else would want to go in and sit for 8 hours a day, or in the case of a wellness therapist, for 12 hours a day sometimes? Who else would want to go and spend their time trying to understand people and on the phone calls and on all the interventions? So we're prone to it. But there's a co-participation in it. When we stop taking care of other people's anxieties, even our clients, in fact, maybe most importantly our clients, when we stop doing that, when we start turning it back over to them, there, of course, like you could imagine, are some of those change back, don't do this to me kind of messages. And those come out in the form of, you don't care about me, you're not a very good therapist or husband or wife or what have you, or mother or father. You're abandoning me. I feel hurt. You don't love me. I hate you, right? You can imagine a number of statements that are intended to express this angst that the other person isn't participating with me. So as we stop participating, as we start behaving in such a way that unconsciously encourages the continuation of unhealthy symptoms by the way we respond, as we start to do that, which all of you have started to do and are on that journey because you've sent your child to second nature, right? They're participating in this program. You've taken a step back. That's why those accusations of you abandoning them have some merit to them, because you've abandoned the old way of engaging, which felt like intimacy, which felt like love, which felt like closeness. But you've abandoned that for what is authentic intimacy and authentic participation, which starts, of course, with getting clear about yourself. And that's why all of you are listening to this webinar. So we're asking parents specifically, but sometimes siblings and others, to stop participating in their old ways. And it's a long, complicated process. And that's why these webinars, and that's why Al-Anon meetings happen weekly, and that's why there are lots and lots of books that you might read. But you don't have to be done, right? The invitation from the identified patient isn't to stop everything and be perfectly healthy. Actually, it is, but really, what they need from you is just to be on your journey, be on a journey that is yours and not theirs. The journey is becoming a better person, becoming a better father or mother, or mentor, or teacher, or friend, or spouse. That's the invitation. And when we make our journey a priority, we're safe for other people in our family, right? The energy is in the family then on a finger pointed at the identified patient, but a finger pointed at yourself, which causes the identified patient, in many cases, to feel less afraid and less shamed in the process. So then they can be vulnerable, right? That's the best thing that we can do to invite the vulnerability in our children is experience and express and demonstrate our own vulnerability. Um, I think there's a certain kind of wisdom that the identified patient has. I remember just the other day, just in my therapy session, which was, I think it was last Wednesday or Thursday, I was thinking about something that I've realized as a professional. It wasn't the first time that I'd realized it, but I was thinking about some things that I was realizing and I was teaching and I was talking about with my clients and with the parents and with our curriculum. And I said to my therapist, you know what strikes me right now is I had this memory, which I've had before, that I knew this stuff when I was 16. Everything I'm telling you now, I knew. I used to tell people what I'm telling you now, what I'm talking about with you folks right now. I have more language and education around it, but I knew it. And everybody told me I was wrong. And I fought with them and I was angry and I wasn't wrong. So there's some wisdom that lies beneath the identified patient's anger and symptoms sometimes, which if we embrace and if we can learn with our ears to translate their acting out behaviors to express difficulties and struggles, if we can learn to do that on our side, then we can begin to access that wisdom and we can begin to give them a place to express it, right? And sometimes that comes out very obnoxious. I hate you. I don't like you. I don't want to do this. And if we can get clear of ourselves in those kinds of processes, then we can create a place that's safe for the identified patient. Another example, which is a little bit more recent and relevant. When I first graduated from my doctoral program, and I started, one of the first places, I think it was the first, well, second place that I worked at after my doctoral program was a wilderness therapy program. And I was educated in family systems theory and family therapy. We do individual therapy, but our focus is still to think systemically because there's a lot of family therapists who only work with one person at a time, typically. Murray Bowen, in fact, one of the fathers of modern family therapy, never met with two people at once, but he thought of things, he conceptualized things systemically, and his interventions or assignments to his clients were all systemically based. At any rate, I was talking with my initial program, and I was saying, we only do half an hour phone call back then. We only did half an hour phone calls with families. There were no phone calls, there were no mid program visits, and there was no curriculum for families. Occasionally, a therapist might recommend a book. Sometimes they were guiding and suggesting letters or giving feedback on letters. But outside of that, it was a half an hour phone call a week. No mentors, no parent coordinators, no family visits, no phone calls, no curriculum, of course, no webinars. And I was saying, I think we need to do more with the families. And they told me to stop, to be quiet, that I didn't understand what was going on. These were people who had been doing it for 10, 15, 20 years. And I said, but, I thought we were taught this, right? I thought we were taught this kind of approach and to work and support the entire system, the entire family. And of course, eventually I had to let go of the battle because I was the new one and they told me I was thinking idealistically and that we just needed to take the children to do our best to fix them and then to move them on to schools and programs that oftentimes lasted 30 months, 2.5 years. And now, of course, this is 20 years later nearly, our version, our wilderness version of family therapy is commonplace. Probably not, well, not as robust as ours in terms of the regional parent meetings and the webinars and the webinar libraries and the many resources that we prop parents up with that put in place to help the system. But it's obvious. And I knew it 20 years ago. So there's sometimes an opportunity to learn something, some boundary that our child is pushing. While it needs attention and it may need an intervention, there's something that can happen at the same time, which is begin to learn to hear what is being said and learn what they're feeling, to not take it personally, to not make it about us, to not make it about our success or our quality as a parent. I was telling a father the other day, the number one enemy to becoming an effective parent is needing to be a good parent. If I need to be a good parent, it's going to be very difficult for me to look at my humanness, my failings, my fallibility, right? That's going to be associated with shame and failure and rejection. But if I don't need to be a good parent, I just need to be me, I'm going to be able to look at and say, you know what, I do have issues around control. I do have issues around anxiety still, even after all of this. And again, saying that, participating in a relationship with your child in that way makes all the difference in the world. So there's wisdom. There's wisdom, there's stretching, there's transformation that occurs in the entire system if we allow. That's why a lot of you have said and will say that this intervention changed you. Not because second nature therapists and second nature program directors said it's the parent's fault, but we asked you to pull out of the co-participant role to work on yourself. And when you did that, you realized that it wasn't about your child, never was, that it was about you and every relationship that you have in your life, and it changed everything. A family that called me from a parent referral yesterday, told me that the original parent had said the same thing. So we're trying to we're trying to restructure the family, and this is so obvious. It's so obvious to everybody. If family parents can do their work, go to therapy, go to meetings, maybe even go to a personal intensive, if they can do their work while the child is in treatment, whether it be second nature or beyond, if they can do that stuff, then it makes all the difference in the world. That the change is more sustainable. It generalizes better. Our young people, our adolescents and young adults retain the improvements longer and at a higher level. So the family work does make a difference. It's probably the biggest variable that helps us predict long-term change. Now, during our program, our clients and students can do very well. And the rates of improvement are pretty consistent, no matter what the family is or isn't doing at home. But over the long period of time and in follow-up studies, we find that to be true. Um, I was co-presenting a few years back with an interventionist. Interventionists historically are thought of in this way. They are somebody you hire that works with the family to create an intervention for an addict or alcoholic, or it could be somebody with other mental health issues, to get that person, typically an adult, to go into treatment. Letters are read, love is expressed, feedback is expressed. The interventionist facilitates and directs that. And the invitation at the end of it is, we have a place for you, you're going to go to therapy, and we want to invite you to do that. And the interventionists are experts at creating a safe context and creating a powerful set of leverage points in the context of that love to invite the identified patient into treatment. And the identified patient is also going to say to the family, and you need to participate. That's a part of the system. But as we were presenting with one of my favorite interventionists, if not my favorite in the country, this presentation, we came to the conclusion as we were putting together our talk and our slides for the presentation, it's not about the outcome. I mean, he knew this. But it's not about the outcome of getting the person to commit to therapy. It is reorganizing the family in such a way as to not participate. It is reorganizing the family in such a way that all of the old escape routes are closed off. That everybody recalibrates their participation with the identified patient in a healthy way. Now, that often leads to a successful intervention in terms of getting the individual into treatment. But that's not the goal of intervention. The goal of intervention is a quick process intervention to get everybody in the system to change their relationship with the individual, the identified patient, and his or her issues or problems. So even with something as specific as an intervention, which most people would associate with the successful intervention means somebody goes to treatment, although that's commonly the outcome, that's the only measure of success. The measure of success is about family systems change and everybody in the family at that. So that highlights this idea of, while we will talk about the identified patient and treat them and try to reduce symptomology, especially in those areas where their life or significant quality of their life is at risk, it's critical and essential that everybody in the family do as much as possible to participate in this. And again, if you're on this list of parents on the left of my screen today, you're doing it right now. You're doing it tonight. This idea that they watched in families about homeostasis is this concept of change back. In fact, I had one of the parents that's on this list tonight write me about this and ask me about this, that when I've made positive changes, he said, when I've made positive changes, not everybody cheers and claps and acknowledges it. They often want to ask me to participate in my old ways. So we know that that's a function of the system, that the system looks for everything to maintain its status quo, even when that change is positive, because it's threatening, it's uncomfortable, right? Those old ways of participating serve the system in a way to reduce anxiety, or at least to absorb it in other individuals in the family. The idea of equal finality and equal potentiality. I haven't spoken on these for years formally on these webinars. It's been 6 or 7 years, but these are systemic principles that say that you can end up in the same place from a very different origin. You can imagine, for example, a child that was abused by his or her parents. And you can imagine that child later on in life wanting to become a social worker to help abused children. You can also imagine a child having a very healthy upbringing, and that person later on in life wanting to become a child social worker to help abused children. So there's an equal endpoint. And the same is true. You can imagine a parent who's self-actualized, who's healthy, who's participating, where a child ends up with all kinds of symptoms, anxiety, substance abuse. And you can also imagine a child from that same parent ending up very healthy and well adjusted. In fact, a lot of you can give examples of that in your family where the child came from the same parent and they end up in quite different places. So the concepts are that it's not simple cause and effect, that each individual's agency, each individual's substance becomes a piece of the story that leads to one thing or another. We punctuate things in systems theory, right? We will talk at times in short spurts and short time frames in terms of let's talk about where this comes from, right? We'll punctuate. It's somewhat arbitrary, right? We'll do a family session. We'll say, well, you did this and then you did this. But punctuation is arbitrary. And if we take a step back and let more time pass, we're going to begin to see the circular causality that they describe in parent-child relationships and systems relationships. Like I said earlier, modeling humility and vulnerability while letting go of the outcome and shifting the focus of your energy is key. It is what I know to be, and for those of you who are new, you'll hear this more than once, but it is what I know to be the greatest contribution that parents can make. When a child comes to you and complains about anything, that you say, you know what? Thank you for telling me. Thank you for telling me you don't trust me. Thank you for telling me it's hard to talk to you. I know that that's true sometimes. I know that I struggle with that. And I need to work on that, and I'm scared. That's a very different response to trying to talk them out of it, trying to lecture or teach or suggest that what they're assuming isn't true in the process. So humility and vulnerability are incredible contributions. And then this idea of embarking on your own journey, making your happiness, your serenity, your peace, your happiness, your meaning in life, your project. And like it talks about in the Joseph Campbell model, which I refer to often, when the hero, the everyman, the everywoman, is invited to leave their current context and try something new and embark on a new journey to find when they initially, by crisis, by difficulty, by something happening in their lives, health, bankruptcy, job change, health scare, child in treatment, right? They're invited to try something new, to go into a scary, dark, unknown place, to look for themselves, which I think a lot of you could describe yourself that way. When we ask parents to do that, the call is initially refused for every hero. Initially, there's a resistance. I want to stay where it's comfortable. I want to stay with what I know. Because that edge of what I think the world is, beyond that, I have no idea. And there's only certain peril and devastation on the other side of that wall. That's what I was told was the end of everything that is real. And then we walk through this door that we're sure is going to destroy us. And we find this whole new life waiting for us on the other process. But be kind to yourself in the struggles. Be kind to yourself when you struggle to walk into an Al-Anon meeting, or when you struggle to participate in a personal growth workshop yourself, or when you feel uncomfortable or unsure when you're being asked to talk about something in a letter, or to go to a difficult place, or have a therapy session for the first time, perhaps ever. Be kind to yourself at that anxiety. It's typical. So we try to intervene on the system. what can we accomplish for the family? We can reorganize the family and take steps toward establishing clear family boundaries, right? That's what we're working on. We give the family a chance to heal. Like I said earlier in the example of the car accident, although one person is driving, every person is injured. And I feel this so passionately, what I'm about to say, that as treatment team professionals at our programs, we have to look at the family and all of its members as clients to some extent. We can't talk about the parents as an object on the way to getting the child better. We have to understand that the parent comes with their own injuries, with their own limitations, and those are honest, and those are vulnerable, and those are difficult. So when a parent is struggling, we at Second Nature have to do all we can to keep the parent in our minds in a non-judgmental, loving, caring, supportive way. Um, Allow each individual in the family to have their own voice, right? To help them find their voice, to help them speak it. Some of it's about communication theory, but a lot of it's about coming to know yourself, to know what your intention is, to know what your agenda is, to know what you're really asking for and communicating, to be able to help you understand what listening looks like and sounds like and what gets in the way of it. So that's really what we do. We give you these tools, these communications tools, because these tools are tools to stretch you, to expand you, to help in this transformation that I'm describing. But the real goal, the real objective is to find a way to stretch yourself, to learn a new way of being in relationship to yourself and others and everybody on this planet. So we try to give everybody a voice in the family. And we try to give them communication skills so they understand what the agenda is that they're communicating for and about, and that they can be more authentic and direct and efficient really in their communication. If done properly, the identified patient will understand that they are loved even prior to knowing how to love themselves. So that's our goal. That's our goal for you, is that we never step away from that core objective, which is that we love, even when you're being stupid or silly or resistant or difficult. Difficult really isn't inside of the person, it's inside of the others. But even when you're struggling, even when your symptoms suggest that you're unpleasant, right? And our children do a good job. They find the things that we train them to find the things that are going to be most offensive and most frightening to us. But we try to reinsert or continue with love while at the same time still holding or developing healthy boundaries. And of course, never losing hope. A lot of the times, part of the symptomology asks us or tests us to give up hope in the problem. Um, this is a message, volunteer to make yourself an identified patient. And what I mean by that is say, I need help. I'm struggling. I'm struggling in parenting. I'm struggling in relationships. I'm struggling in communication. I'm struggling with my own history. Ask to be the focus of care, to model that for your child. And there's no equation that it's 99% your child's issue and 1% yours. The equation is your child is 100% responsible for his choices or her choices, and you're 100% responsible for yours. So this idea of meeting each other halfway or doing 50% of the work doesn't make sense. It's still in that model of who's to blame or who's more to blame. We try to, through the communication skills and through asking you not to speak with imperatives, we try to take away the language of blame and shame, so that it becomes a discussion about pragmatics, about each person finding their best self, and about an individual learning to work their way out of symptoms, not from a place of fear or shame, but from a place of love and compassion for oneself. But it's hard for us to shift to that model because we've learned that shame and blame are the best tools for change. And they're really not. They're really a short-term symptom reduction, but really don't address the heart of the problem. And there's a saying that says, hatred can't get rid of hatred, that it only can be addressed with love. So if we come in with a lot of energy around shame, first of all, that comes from our context, our background. But it's going to be more difficult and more scary for the person to truly get at what the heart of the matter is. That we understand that the gift that we give to treatment, the gift that we give when we love, the gift that we give when we parent our children, that we're not asking for something back like appreciation. Otherwise, it's not a gift, right? If it's really a gift, if this task of this effort of parenting for all of us is really about giving love because it feels good to love, because it's the right thing for us to do, then we don't ask for something back. But when we become very reactive to a lack of appreciation, when we become very reactive to the fact that look at all I've done, you still haven't changed, or look at all that I've done for you and you don't respect me, we weren't really giving a gift. We were making payment for something in return. And sometimes our children can sense that. And by the way, we all do this to some extent. And again, this does not mean that you don't have boundaries and that you don't practice healthy self care. But resentment is evidence of the giving of something with the expectation for something in return. Take ownership of your feelings and your life. That's really the message of the whole webinar, many of our webinars. Make this about your work and then turn your child's life over to them and practice that every day. Because our instinct, right, our wiring, our hard wiring tries to pull us back into the place that other people need to change so that we can feel okay. Because we don't want to have to do the thing that we need to do to take care of ourselves because it's scary, because the potential outcomes of rejection are very, very powerful energies in our life. Making your serenity and your self-esteem as a parent your project, and this is a daily battle for all of us, right? My child's failures and successes are not mine. My child's limitations or achievements aren't mine, right? But we kind of think that way, don't we, a lot of the time? It's easier to talk about the child that's going to Harvard than it is about a child that's in the wilderness. And really, the thought is, I'm not sure why, right? I'm not sure where the shame is. I saw something one time where somebody shared with their parent that they were going into treatment. They were checking themselves into rehab. And the child expressed a great fear that the mother was going to be disappointed because other children in the family were going on to Ivy League schools and great successes. And the mother responded in the best way I could imagine. She said, I've never felt so proud of any of my children as I do for you in taking this step. And that's really what I want all of you to feel. The people out there that think that you or your child are some kind of freak, they're wrong. The people out there that have been through pain and have learned to cope with it and deal with it and face it authentically, all they have is compassion and respect for you. But we've been taught that what other people think about us is about us. And so we get confused and we lose ourselves easily. The only thing that I know about the people that are on the list on my computer tonight, the only thing I know about you, the only thing I can assume about you is that you're trying. I don't know if you were overly involved. I don't know if you were cut off from your child. I don't know if you're shame-based. I don't know if you have addictive personalities or strongly codependent. I don't know any of that. The only thing I know, or I can assume about you, is that you're trying. And that's impressive. I did an overnight this weekend with some professionals. We got to the point where we were teaching them how to do bow drill fires. And these are treatment professionals. Wonderful, well-adjusted, as far as I could tell, treatment professionals. And I was working with one individual, and she was trying to do the bow drill fire, and I could see her getting upset and feeling shame and close to tears and anger. Later, she told me she had a lot of negative self-talk at one point. And I was more impressed by her than I was by the 3 or 4 people that got a bow drill fire within a couple of minutes, by far. That she stuck with it, that she addressed it, that she looked at it, that she expressed and she made her vulnerability visible to others in the part of the process. Discovering the treasure and the wisdom of this journey has to offer. I say this, and I know I'm a broken record sometimes, but someday people aren't going to know what that phrase means, right? A broken record. But the treasure and the wisdom that can be gleaned from this journey is everything. It's fantastic. It enlarges our compassion. It enlarges our love. It enlarges our gratitude. It enlarges our awareness of ourselves and others in the process. It takes away judgment. It takes away fear and anxiety to the extent that we do it. It helps us to see things that were invisible to us. And that's why I've said that if we focus on what shouldn't be happening, right? The life that we planned for, the life that we expected. And there's grief and there's loss, and that's okay. And if we stay fixated on, let's get back on course, I want to get back to what is normal. This thing that's happening is a detour, is off track from the way things should have been. When we get in that mindset, it's going to be very difficult to recognize the treasure and the wisdom that the journey has to offer. So, hopefully, and ideally, when we are in these places, when we're accepting and embracing the journey, as painful and difficult and scary as it is, when we become invested and mindful of our lives and our relationship and our child and their struggles, we'll develop a certain kind of ability to see the joy and the gratitude in our lives and in every area of our life. So that's what this is asking. And really, in a lot of ways, we talk about this in therapy all the time. This is where the identified patient, in some ways, becomes the family hero. And my older brother and younger brother, whom I love dearly, did not go through near the kinds of problems that I have. And I was good at getting into trouble. And the kinds of problems that I had, and the invitation that it was to my mother specifically, raised by a single mother, and to the others, but specifically my mother who embraced it, added a certain kind of largeness, a certain kind of depth, a certain kind of intimacy. And even though my brothers, teenagers at the time, didn't want to participate in and were reluctant to participate in, there still is in our family system, from the crisis that I went through for many years, that created something different in our family and something different in relationship to me, meaning my relationship with my mother specifically and with my brothers has a different quality in many ways than their relationship with each other in some ways. And they have their gifts and they have their wonderful contributions and different than me, but there's something that the identified patient can add if we allow him or her to do it, if we allow the journey with him or her to be our journey also, to be something that we ask ourselves tough questions and go into difficult places and stretch ourselves. It can be a wonderful, wonderful gift. In my experience, it is, I love it as much as anything. We have kids coming into the program every day that have lost a father, that are dealing with alcoholism or drug addiction, that are cutting on themselves, anxious, that are refusing to go to school because of school anxiety, that are depressed and don't want to live at times. We have all these wonderful, beautiful, intelligent, gifted children coming in with all of these diagnoses. And it's a pleasure to go to work and to sit with them and to hear their pain and their sadness and to have the capacity. Partly I have an advantage because I'm not their parent. It's much more difficult with one's own child. But I get to sit with them and just love them. And we have lots of consequences and limits and boundaries, so it's not that, but I just get to see them. And it enlarges me. And it does add something to them in the process. So those are my thoughts on the topic tonight. Are there any topic-related questions that have come up, Stephanie? I'm happy to address those. My son is coming home for the first time in 5 months to be assessed for an IEP. I'm worried about how to focus on positive changes and not regress into old patterns. I worry about how it will go in finding balance between making sure my son is safe, controlling, and having quality time together. What suggestions can you give me? I like this question a lot. It's okay to worry. It's okay to be anxious. It's okay, but it's yours. So just own it first and foremost. It's mine. I have this thing where when I see my child potentially making a dangerous or stupid decision, I get anxious and worried. That's mine. And I'm going to work on that with my therapist. I'm going to work on that with Brad on the webinars. I'm going to work on that with meditation or daily reading or going to meet. I'm going to work on it. So it's mine. And then the fact of the matter is, we don't have to, it's not so much a focus on, is my child doing well or not, that gets in the way or helps us to succeed. It's understanding that it comes from an injury. It comes from a hurt. And so I can see my children or my clients doing things that you might call stupid things or unhealthy things. But when I react to it with anger, with frustration, with judgment, instead of saying, that's going to hurt them, I have so much compassion and love for them. I want to understand them. I want to understand where it comes from. And I really want to listen. Not that fake kind of I want to understand, but I really don't understand and I'm really going to argue about it. I want to understand it because every symptom that everybody has that is outside of loving, compassionate, connected, warm, nurturing sense of self and relationship to others, anytime any of us are outside of that, it's because of a wound, a fear, an anxiety, a hurt. So that's how we look at it. And that adds a certain kind of patience and it changes our reaction. So folks, I'm not saying stick your head in the sand and don't focus on it or don't see it. I'm just saying embrace it, understand it, and practice what Thich Nhat Hanh would call deep listening, which means we listen beyond the words, beyond the content, to find that little child who's scared and hurt. And in terms of quality time, it's an interesting question. I used to say this about people that were making parent visits, parents that were making parent visits. If your goal is to have quality time, and quality time is defined as happy time together, you're sunk. Okay? Because a lot of times I would come out to a visit after several hours and I would say, how's it going? And I would find that the parent was upset or scared or frustrated and hadn't expressed anything. And my question was, why? Or there's some difficult things that the child hadn't brought up that they said they were going to. And my question would be, why? And in all of those cases, the parents or the child would say, I didn't want the quality time to go away. Quality time means authentic time. Quality time hurts. See, we have to change our relationship to pain and sadness and grief so that we understand that there's no happiness or joy outside of those feelings. That our grief and our sadness and our hurt is our joy and our happiness unmasked, right? It's the other side of the same coin. And so quality time isn't about happy time or fun time. In fact, I read a study 20 some odd years ago where one of the difficulties with parents who had children in daycare, if they were working all day, is that they wanted the time in the evening with the child to be happy time. And so while the daycare center valued compliance because there's several children with some supervision and being compliant in groups was important, that sometimes we need to see our conflict with our children and our difficulty with children as quality time and time that we can work on and improve and learn about. But I think it's about changing, not being held hostage by the expectation or desire to have it be happy and warm and satisfying and joyful. And to realize quality time might be the hardest. I'll tell you this one last thing to make the point and then I'll move on. I've said this a couple of times before, that, and I can think of out of the hundreds and hundreds of family visits that I've had over the years, the ones I remember the most were, in many cases, the most unpleasant ones. And they were the ones that the child, sometimes, and the parent often said, that was the turning point. That's what helped me to get out of it. I hated that day. I was sad. I was angry. I was hurt. I was scared. But I learned something. So I think quality time is authentic time. And I think if you set too much of a goal on happy, fun times, pleasant, non-conflictual time, you're going to be tempted to sacrifice authenticity and directness and honesty and healthy participation in self-care. And at some level, your child knows that. And that's what anybody, including our children, can then hold us hostage with is, you're going to ruin this. Look what you've done. And it's not said like that, but it's communicated. So I would practice on being as honest, being as connected, and try to be as humble as possible and talk about, I'm scared and I might make mistakes. So punctuation is the arbitrary, we imagine a circle of a bunch of behaviors in a circle, and we just take out one part of the circle and look at it. Mom yelled at son, son felt hurt and shut down. That's punctuation. We arbitrarily take a slice out of the circle. Now, if we put that back into the circle, we would see that, yeah, before the mom yelled at the child, there were 14 times that the child ignored her. Then we could punctuate that and say, it seems like we can talk about this idea that your mother's raising her voice might not be the most effective solution, but where did that come from? Well, the last 14 times I just ignored her, or I was passive aggressive. Okay. Then we punctuate that. Then we look further back and we say, okay, why were you passive aggressive? Well, because this, right? So you can talk about it as a cycle and a circle, but you can also talk about discrete transactions in a relationship to make sense out of them too. That's what punctuation is. All right, folks. I hope this was helpful. Thank you for joining us to the webinars, and hope these points of contact are helpful throughout your weekend. Thank you for joining, for you and for your child. And again, just be you. Try not to be a good parent. Try to be you. Because being a good parent is going to make it difficult for you to look at your mistakes and your failings. And you're going to be likely hearing when people talk about your mistakes as a human being, you're going to hear those in the context of blame and what did I cause other people to do. You're going to hear a dismissal of the accountability for others and your child in the circumstances, and there is no such thing when I talk about looking at yourself and being open to the process. Go to these meetings. We want you all to go to 6 of these, or a combination of any 6 of these while your child is at second nature. I would like you to be exposed to them as many times as you need to get the help and support. Here's ways that you can stay connected to us. I have a couple of new slides, by the way, coming up. So we have New York City set for Thursday this week. I'll be there 6:30 to 8:30. If you haven't RSVP'd, please RSVP to webinar@drbradreedy.com. We've changed our address, as you might have noticed. You still have access to all of the old archives, but we're going to begin recording on these archives. And Chicago, December 16th, we're doing a parent meeting, and more details to come on that. It'll be actually on Northbrook, is that right? Stephanie, I think it's in Northbrook. I think it's at the Renaissance on Skokie Boulevard. One of our former parents has invited us to speak at their home, do a parent meeting there on January 11th outside of Baltimore. If you're in the DC area and you can make the trip, fantastic. And then coming in January, if you live in a metro area and you have a space, it doesn't matter if it's a church or an office or your home that's large enough to fit 12 to 20 individuals, please let us know at webinar@drbradreedy.com, and we would love to give everybody in the country the opportunity to have some of these support groups and to develop a support group culture in your community. And announcing, some of you know about and have heard about, the Second Nature Alumni Foundation. We've already collected quite a sum of money, and this is a foundation that was started by former parents, by alumni parents, and it is a nonprofit organization committed to providing assistance to help remove financial barriers facing teens and adolescents. So not all the money is going to go to Second Nature. Some of it's going to Second Nature and their families to help. Some of it's going to go to aftercare or other programs or other wellness programs. So we are very happy to announce that. Any information, please contact Gail at 2nalumnifoundation@gmail.com for upcoming volunteering opportunities, fundraisers, and so forth. And I'll be doing some stuff for them in the coming months. The next webinar will be the open forum. I'm going to be in New York this week. So the next webinar is going to be Monday, November 24th at 6:30 p.m. Mountain Time, so a week from today. Again, thanks for joining us. Any feedback, any questions, any requests, webinar@drbradreedy.com. Be happy to address those. Thank you, Stephanie, for helping this evening, and I hope you all have a good week. Take care. Bye-bye.